Hi, I'm Jason Bellamy with Jason Barbas, coming to you from the Shirley AbilityLab here in Chicago. We are right near what was the old rehabilitation hospital, which Shirley AbilityLab became. This facility is just over 2 years old. It's huge. It's bright. It's welcoming. But more than that, you guys have, it's not the size that makes you stand out, it's really your approach. Tell me about the approach here. What's different about the way you guys approach things versus a traditional rehabilitation center hospital?
I think the biggest difference that we have with the move to the new building is that the building itself was designed to enable the vision and was really meant to reflect the vision of the Shirley AbilityLab. Really to have a translational model where clinicians, scientists, researchers, therapists all come together in one space and interact in one space to solve clinical problems. So that idea maybe isn't new, except for putting everybody together in the same room allows those transformations and discoveries and all those things to happen more quickly and to happen in a little bit more real time.
So when you talk about research, that's something we don't usually think of as quickly, right? It takes a long time to do the research. It takes a long time to apply the research into practice. So how does that change things here? How does it accelerate that process? What's the give and take?
I think the place to start is you have to ask the right questions, the right research questions. And I think, our researchers and all scientists are really inquisitive people by nature. And so if you put them in a space where they can observe what the real clinical problems are, they see the patients working with therapists, they see the physicians talking to patients, and then patients are able to also speak to what questions are important to them, what rehabilitation and therapeutic interventions are important, what outcomes they want. Then it allows the researchers to know, all right, this question is important. Maybe this question is interesting but less important. And so I think if you have that investment in the right question from the beginning, then it's easier to implement the solution when you find it. Because you have all the primary stakeholders are invested in the answer to the question to begin with and actually inform the question. Yeah. So I think you get more buy-in to getting the answer. I think the other piece is on the back end is you have relationships between clinicians and researchers. As you create that space for that, then the researchers, when they're disseminating the information and their scientific discoveries and all the wonderful things that they discover, they have the right audience in front of them already. And so again, the information gets translated more quickly.
Research is a part of it, though. Interdisciplinary care is obviously something you're all about here. I mentioned the bright, welcoming spaces. There's so much natural light coming in. I've got a beautiful view of the river and a lot of the floors that you're on. What's the patient experience you're looking for? How do you want people to feel when they're here?
I think patients tell us they feel a sense of hope. I think they come here because they know that we are outcomes focused. And then while the process is important and you have to execute all your processes well, it's the outcome that is the focal point for us. I think they know that we attract a lot of talented clinicians, a lot of talented researchers, but by putting them in the same room together, we can help solve their problems faster. One thing that's different that we're doing in inpatient in the last couple of years is for patients, they will have a therapist. They might have a physical therapist that's their primary therapist that focuses on spinal cord rehabilitation. They're an expert in that area. But they might have a vestibular problem, or they might have shoulder pain. And in our traditional model before that, we didn't really have access to, all right, well, if your spinal cord therapist happens to be good at that, then great. But if not, then we don't have a mechanism for getting that expert in front of you. So we have AbilityLab therapists here that are part of the inpatient care team that work closely with our researchers. They're on the cutting edge of what the research says about those areas, and they can treat that spinal cord injured patient's shoulder pain, or they can treat that vestibular problem they have, in addition to having access to that spinal cord injury expert. So I think patients have a confidence that when they come, they're going to get all the expertise that they need, regardless of which primary team they land on. They're going to have access to all the things that address all their problems.
Right. You talked about how things used to be and how things are now. Like I mentioned earlier, it used to be the Rehabilitation Institute of Chicago. When you made this move, that's when the name change came. And Shirley AbilityLab, there was a very conscious decision to go from rehabilitation to ability. Talk about the message that's supposed to be signaling externally, but I also want to know, what has that meant to the people here, the people practicing, how you approach things?
Yeah, I think internally and externally, it's a shift in focus away from a process. So rehabilitation is a process, which is important to do it well. But the shift to ability and drawing attention to ability is a focus on the outcome. And so that's what patients want when they come here. And that's what where our focus has shifted is, again, we want to be good at our process, which we have been for a while, but we want to hold ourselves accountable to the outcome. And we want to improve the outcome for the patients going forward. So that's the shift in focus. I think internally and externally. With our staff, we focus on outcomes. We focus on patient outcomes in everything that we do.
And so is the ability part tied to the outcomes, or is the ability part also just part of the focusing on the positive more than the negative as well?
It's both of those things. Yeah, it's focusing on the outcome, and it is to send a positive message to. We want to enable people to have a positive experience. We want to teach them how to make the best and get the best out of their ability that they can, and we can teach them how to do that, whether it's through recovery from the disease process or teaching them how to do something a different way.
It's an outstanding facility here doing outstanding work in Chicago, and I'm Jason Bellamy, and I'll catch you later.